Welcome to Awareness to Action, a podcast brought to you by Northwestern Community Services Prevention and Wellness. I'm your host, Casey, a social worker and prevention and wellness specialist here in Virginia. Our goal is to bring you stories of people who are engaging in their communities in meaningful ways, to hopefully inspire and encourage you to seek those connections in your own community. Hello, and welcome back to Awareness to Action. Today we have Mathew Snyder joining us on the show. Mathew Snyder knows firsthand how unaddressed trauma can ripple through generations. Over the course of his life, through adverse childhood experiences, his military service and education, Mathew never stopped thinking about prevention and how to break the cycles of trauma, addiction, and loss. In 2021, Mathew founded RemedyGuard to tackle these issues head-on. He believes real change comes from activating parents, equipping them with the knowledge and tools to secure lethal means before tragedy strikes. Through coalition building, public health advocacy, and direct action, he works to turn awareness into lasting change. In our conversation, we discuss Mathew's company, RemedyGuard, the key differences between availability and accessibility, and what it looks like to build trust within communities. Mathew has a true passion for this work, and I so appreciated the chance to talk about his advocacy and service. As a heads up, Mathew and I discuss overdose loss, substance use, and suicidality in the episode. It may be difficult for some listeners. As a reminder, help is always available. The Suicide and Crisis Lifeline can be reached by texting or calling 988. All right, Mathew, thank you for joining us on the Awareness to Action podcast.
It's my pleasure. Thank you for having me on.
I'm so glad you're here. I'm excited for our conversation. Let's start with you telling our listeners a little bit about yourself and why you are so passionate about prevention.
A little bit about myself. I'm one of those Gen X latchkey kids that grew up with kind of half a parent staying out all day, borderline feral. And the environment that I grew up in was not the most healthiest of environments for kids to be growing up in. I had a father with mental health issues. He was a paranoid schizophrenic. And so I got to experience like all the different adverse childhood experiences growing up. But as a kid in a fishbowl, I didn't understand that only like 1 in 6 Americans deal with 4 or more adverse childhood experiences before they turn 18. So fast forward to adult Mathew, and during the pandemic, a medication lockbox company got put on my shoulders. My old boss was like, here you go, here's a company, run it. And for 6 months, I was fielding calls from universities and health departments and whoever, looking for the lockboxes for their outreach events. And it was this eye-opening time for me where it's like, oh, wow, there's a lot of prevention that's happening in our country. There's a lot of really good work happening. We just need to really support what's happening, the work that's being done. And yeah, I mean, it's just kind of wholesale business stuff, but it does have a direct impact on the events, the outreach, because if you're telling somebody, hey, this is a step that you can do to make your home a bit safer and keep the kids out of the ER and all of that, you got to give them those tools. So if that tool isn't available, then the impact isn't quite there. And so I absolutely had to take it upon myself to start my own company to address that so that the work can happen. And I'll tell you, it feels really, really good to have these organizations reach out to me and say, hey, I heard you got something from these other folks that are also doing the work. And it's kind of given me a bit more purpose in life, so to speak. Another thing about me is I'm an Air Force veteran, did 2 tours in Iraq. And going through and doing that, it definitely lends a perspective on everything. Like, we can operate strategically. We're not on a battlefield. It is, in a way, life or death, but it is not the immediate threat. We can plan for this stuff. We know in general that these adverse interactions are going to happen. It's not the Minority Report. We can't say exactly when or where, but that it is. And so to raise the awareness across the board about just injury and violence prevention, overdoses being, I mean, it could be an injury, it could be violence, because that overdose could be from an intentional overdose. And it's one of those things that it keeps me going, keeps me awake at night sometimes, thinking about what more can be done, how better can we serve the people of our nation.
I appreciate that reflection that it's a pressing issue, but we have the time to slow down and think about it. Like we can be strategic about how we're addressing these issues, what resources we're putting into them. So, talk to us a little bit about, as you mentioned, you're the founder and owner of RemedyGuard. What was the step of, I'm running a lockbox company to, I got to do this my own way. Let me start something new.
So, like I said, that company got put on my shoulders during the pandemic. And then the company that I was working for, they had to look at their own books and everything. And they're like, we have to make you redundant. You're one of the top paid people in the company. So, we're going to go a different direction. And it was one of those things where I said, well, I know what they're doing. And I already did market research about the lockbox companies and what's out there and what folks are doing. And I didn't see that affordable, available option coming around. I couldn't say, oh, okay, one of these companies will see the need for something at a certain price point and make it happen. So it was just follow the logic, go down the rabbit hole and say, if I don't make it, I don't think anybody else will. And I was fortunate enough to be in a position to get it started. And it took a little bit of time and it took longer than I wanted it to. But talking to other folks that have been starting businesses or people at in high level corporate kind of areas, like I moved pretty quickly and I was able to figure things out pretty quickly. Being a one person shop, there's the benefit of being nimble. I don't have to take anything to a board of directors or advisors or what have you and say, hey, we need to come up with a new product. And it's usually like a 2 year lead time on getting a new product to market. Theoretically, I can do it in 4 months, just based on production cycles. It was serendipity in a way, getting started in something like this. And once I was getting a bit more under my feet and ready to say hello world, January 2023 is when I actually said, okay, let's send out an email to a few hundred of the drug-free community coalitions that were funded by the CDC and see, hey, where's your need at? What do you need? And I actually got an order off of that little email blast. And it was only for like 20 boxes or something like that, super small. But in my mind, that should not have happened. I shouldn't have received even an order, maybe an inquiry of, okay, well, who are you? Let's have a chat, some more information. But no, it's just like, we need this so bad, we're going to just buy it right here, right now. And it freaked me out. It did. And I was like, okay, I need more resources to really serve my customers. And so I started looking at entrepreneurship training programs and found that there's a lot of resources out there for like veteran entrepreneurship. And so I started taking all those courses, all those classes, and it was eventually like June, July of 23 where it was like, okay, I know now that if I'm going to do this, I have to do this kind of on my own. There's no external sources for funding for what I'm doing. And so that's what I did is I put in an order for my first 20-foot container and got that pulled over in the fall of 23. And like a month later, my biggest customer came in and took half the inventory, like all of my combination style boxes, because that's what a lot of folks like. And then it's just been kind of going since then. Word gets out, hey, they've got some pretty good boxes at a really good price. Hit them up. And so I've been doing the circuits, so to speak. In 23, I attended the RX Summit in Atlanta. And that was even more eye-opening than just having people call me up looking for a product. Because I say I got to, or I had to listen to all of these outreach and prevention specialists talk about what was happening in their communities. And just, amongst themselves on the exhibit floor, hearing, oh, yeah, we just had to bury 19 people in our community because of a tainted drug supply. Even thinking about it right now, it kind of like it messes me up. This is our nation. These are our fellow country people, and they're dropping like flies because Because of reasons, yeah, tainted drug supplies. How did they get tainted? Why are we doing drugs to begin with? What can we do to educate folks on maybe making healthier decisions and all of that? And so, how does medication lockboxes tie into something like that? But it is all part of the work. There's just different building blocks that go into these support networks. And I don't know, to me, this is for what I'm doing, it's like the easiest way to address this stuff just by ensuring that there is this supply of products that can be used in the outreach efforts. In my mind, when those efforts are fully supported and all these people can be out there in their communities, they're building trust, is what's really happening. And so a lot of the future incidents can be avoided. We can educate folks on things to look out for, ways that they can make their environment better. And I see a lot of repeat. So parents going back, hey, I heard about something on the news. What are we doing to address this? And furthering that public engagement with public health, essentially. The pandemic was very eye-opening in revealing a lot of the mistrust that there seems to be with public health in general. Like, people are just trying to keep us safe from ourselves or from external threats, or I mean, there's just so many threats out there that we're having to face. It's not some conspiracy stuff, and it's not all for nothing. It's evidence-based prevention. The data is there, and more can be done, more should be done to right wrongs, to make things better. I mean, this is America, right?
Yeah, and I appreciate you calling out the trust aspect of it because I don't think we talk a lot about how crucial trust is in prevention work. But if that's not there, then I have no reason to believe you're coming into my community with all this information and these tools. And I'm like, oh, what are you trying to sell me? I think we're kind of in a place as a society where, as you're saying, trust is lower. But if someone can come in and say, actually, I really am just here to help. Can I show you some numbers? Can I talk to you about what's going on? Can you tell me what's going on in your community? Because I'm not a member here and I want to learn from you. I'm not coming in as the expert. I'm just trying to talk to you about things I'm seeing in other places and things that might be happening here. It's a game changer.
It is, and I'm not 100% sure on exactly how the prevention work is really seen in the communities. I know that there's a lot of support for the work, and when the organizations are out there tabling, connecting things like the lock boxes or bags or the physical, tangible things, they tend to move rapidly and faster than other resources that might be shared at the same table, like WIC resources, women, infant, and children resources. So it's a bit telling that there's a desire for, in our homes, people, once they're made aware, they're like, oh yeah, I can do this. I can grab this. I can do that. Now, granted, a couple of those boxes might end up on eBay or something, which I've seen my stuff on there already, which is, I'm kind of cool with it. Like, okay, I mean, you got it, and maybe you said, okay, I don't really need it, and then they're making it available out there as well. Okay, cool. And if somebody wants to buy one of the boxes on eBay from somebody else that got it, then okay. As long as somebody's going to get it and somebody's going to use
Yeah.
it and help prevent accidents,
Hmm.
that unintentional or even intentional. That's another thing that kind of kills me, hearing about and whatnot. It was last year, I believe, I was speaking with a prevention specialist in Colorado, and she has to handle like 20 counties by herself, and it's pretty rural. And what she's dealing with out there is the intentional overdoses of over-counter medications with teens, and they're not taking like a little bit, they're taking the whole bottle. The intention is clear. And going back to like more about Matthew, I did make an attempt on my life in high school. Things got bleak. I didn't see a light at the end of the tunnel. I didn't have good future prospects or what have you. And so I took some steps before taking my own life. Like, it was right there. And I got so angry. I was like, yeah, all the bullies, they're gonna win. Because that was another thing, it was just the constant bullying. It was spite that kind of kept me from committing and being like, you know what, I've got more to do. There's got to be something out there. There's got to be something. And it felt like I had exhausted a lot of avenues, but I persevered. So when I hear about all the kids that are out there that are lost and hopeless, like I was, it's like, let's do more. We absolutely can do more. And it's kind of crazy how, I believe in general, our nation is largely unaware of the prevention work, of the different steps that folks can take to make their homes safer, and how it is a pretty big issue. Last numbers I heard was 35,000 children under the age of 5 ending up in the ER every year because of medications left out. That's a pretty big number. Although from my understanding is that like that 35,000, it's like a continual constant number. Yeah, fluctuates maybe a little bit, but obviously the kids are growing up. So these are new kids every year. So where's that number? Like 35,000. How can we get that down? Sometimes I get all philosophical in my own head and like, is this just the nature of things in so much that that's where our gaps are? Or can we actually completely eradicate those numbers? Or, get it down to in the hundreds, maybe.
Yeah. Well, I also think the term prevention it's sometimes shifted in the last few years to be health promotion, which I think the two terms go well together, but it really is an education piece more than anything. I don't know if the broader community thinks of it that way, but it's like when you know better, you do better. Like I did not know what a medication lockbox was until I started working at Northwestern. And Shannon introduced me to one, and I said, "What on earth? Why do we not all have these in our homes? How am I like 21 and I'm just learning about this for the first time?" I really couldn't compute how I wasn't aware of it. And again, it was just like, oh, well, every home should have this. And now I think that every home I have will have one just as a safety precaution. But all it takes is one person saying, "Look, here's something useful for our community. Can I tell you about it?" And actually, I'm realizing that maybe we should go backwards. Can you tell our listeners what is a medication lockbox? Like, actually, what is it and why does it matter? Why have you devoted yourself to making sure that they get in people's hands?
So a medication lockbox is effectively, they come in different shapes, sizes, materials, but it's a locking box that is intended to store medications. And our medications come in a variety of shapes and sizes, so there's not like a one size fits all. But we got like a personal size, which is just a hair smaller than like a shoebox. And that is good for people that don't have a lot of medications to manage. And then there's larger ones that are more intended for like families or individuals that are on quite a few medications. And then other ones, like I just came up with a medication assisted treatment lockbox. So it's like the large box, but with a foam insert that can hold 30 days worth of take homes because it's medication. It's another thing that needs to get locked up. And I didn't see a lot of good solutions out there. Now, at the end of the day, these lock boxes, they fall into the realm of lethal means safety because there are medications out there that can kill people. And this kind of ties back into Air Force Matthew and seeing this stuff for what it is. It's not just some pills that you got from the dentist because of a root canal. It is something that can pose a serious threat to a life in a home. You can't get more basic and straightforward than that. And so, yeah, for me, it's making the home a bit safer for kids. Who doesn't want to grow up in a home like that, where the parents or the caregivers are keeping an eye on that kind of thing and ensuring that I'm in a safe space?
If you saw me get a little teary-eyed when you were talking about medication-assisted treatment lockboxes, I used to work in medication-assisted treatment, and the lockboxes were such a struggle, like finding ones that could fit the amount of take homes that a person had, finding ones that were secure, and that's something that you're traveling with. So it's not just something that's like up on a shelf in your home. So something that could actually protect the medication. It just makes me really happy that you are working on that. That's such a specific group of people that you're caring for by creating that. So let me say thanks on behalf on behalf of a lot of treatment providers and folks who are receiving medication assisted treatment. That is really awesome.
You're welcome. Thank you. It's one of those things where I was just doing medication lockboxes and I had somebody in recovery reach out and he's like, "Hey, you got these take homes and this and that." And like, "What do you have?" And so worked with him a bit and like, okay, the small lockboxes, they can only hold like 9 take homes. And usually when folks start that road to recovery, they have to go to the clinic. Let me back up actually for a second. There's over 350,000 Americans that are in medication assisted treatment. And that could be anything from methadone to buprenorphine to there's other ones. And so when somebody goes into treatment, some insurances will cover up to like a month. Some will cover like 2 weeks, others they don't cover it. And so folks are having to pay out of pocket. And when they first start the program, they have to go to the clinic for their dosages. And as they move through the program and build more trust, I believe, with the providers, they're given a set amount. Usually they start it at like a 2 week, and then eventually folks graduate into a full like 30-day take home so that they're not constantly having to go to the clinic and then they can administer the medications themselves. Now, with that, there's a DEA guidance saying that like all those medications have to be locked up in transit. And it is just a guidance at the DEA level. There are certain places, jurisdictions and whatnot that have put out mandates that says it must be locked up and this is what it has to look like. So Kentucky, you can't throw all your bottles into a bag. It must be a hard body type box. Understanding these requirements and what folks are going through, and I've browsed some forums online and looking what other people have encountered in their areas, like, oh yeah, we can definitely address this as well and do better in this realm, and at least put the products out there and say, hey, well, here's an offering, here's more of a choice. And so you're not stuck with some child's toy off the internet or something, because I've legit seen that. And it could be because it's an internet forum, some folks being funny, but I see like literally a child's toy being pushed as a viable option to lock stuff up. And no, no, it's not.
Yeah. I mean, it's just another example of being able to say, like, I see this gap. Let me try and do something about it. And I just really respect that. I want to talk about the community and collaborative piece of your work. You have said that RemedyGuard's mission cannot be completed alone. Can you speak to what it has looked like for you to collaborate with others in this work? Maybe who you're collaborating with in your distribution network and which community partners you've really been able to rely on?
Absolutely. Now, the collaboration, it is not as collaborative that you might think. The prevention organizations or the children's hospitals, universities, etc., they come up with like their own materials for what they're educating on. Lockboxes are so utilitarian that what they're seeing and what they're trying to address, it can look different. Is it a young child getting into something on accident? Is it a teen getting into something on purpose? Is it an adult getting into something on purpose? So is it just medication safety? Is it suicide prevention? So when I'm interacting with all of these organizations, they indicate to me what kind of more support they might need. I've had one or two organizations ask me to help provide those materials, and I have. But by and large, folks come up with their own materials. Now, based on feedback that I get from customers, that's where a lot of the collaboration can come in. So last week, I sent out a survey. Hey, how are we doing? And 5 stars generally across the board, real good. But little feedback on like my keyed lock boxes. So when an organization orders a few hundred and then they've got to unwrap them, take the key off the handle to unlock the box to then put their materials in, they're like, can they just come unlocked? I'm like, I think we could do that. save these folks a lot of time. Like the combination style, super easy. The key lock, it's like, okay, well, let's reduce that friction. I don't see why we can't do that, even if it's just a matter of putting a little bit of tape so the box doesn't flop around when you unwrap it, you know? That kind of collaboration is where I'm able to help a lot more. Or say like St. Louis County, Minnesota, or Panhandle Health District, Idaho, they put stickers on their boxes. There's lead time for doing that because if you're going to go and put a few stickers on hundreds of boxes, like it's going to take a lot of time. And with stuff that's being given away, there's sensitivity to the price point. So that's also how I'm able to help them say, okay, let's manufacture these with your stickers in place so that you can have something that's even more customized to your area and your folks, and you're not having to put thousands of stickers on boxes. So that's really where I'm coming in to play with a lot of this, the collaborations, is looking at what's going on out there and what can we implement for the greater good just as is versus some custom one-off, like, okay, well, if you need this to look like this, here's the extra cost. Or, oh, like my boxes originally didn't come with pre-drilled holes. So if people wanted to mount the boxes into a cabinet, they would then have to drill through metal, which it can be just a bit more of a pain. And but when I was at the RX Summit, some dude was like, hey, the guy I get these from, they already have the holes in them. I'm like, let me go to my manufacturer. Let's see what that looks like. And the manufacturer was like, yeah, it's like 10 cents. We're just going to do that. It's going to save people more than 10 cents in time to drill those. So again, that's kind of where I'm coming into play, is listening and reacting, responding to that kind of feedback on, well, how can we make this stuff, again, just better, more usable? What does that stuff look like?
Yeah. For anyone listening who's like, does it really save that much time to have an unlocked box? I have yet to meet a prevention specialist who is sitting around with extra time, twiddling their thumbs. And I can also tell you, as someone who's been in a room full of lock boxes that needed to be unlocked and stuffed with materials, that's like music to my ears. That is a crucial collaboration that you're giving people. That's really cool. I feel like you're really skilled at communicating the need for your work in numbers. Like, I'm someone who's probably more likely to view an issue always through an emotional lens, and I do love a good set of numbers, a good data set. But I think that your use of numbers in your mission is really compelling. So, like, can you talk with our listeners a little bit about why it's important to share the data when we're talking about medication lock boxes in terms of economic impact and emergency room visits and the return on investment of prevention work? Tell me where that comes from.
So, looking at our spend, this one kind of goes back to Air Force, Matthew. And I was fuels in the Air Force, jet fuel, that kind of thing. It's tip of the spear logistics. No fuel, no fight. Like, you can't walk a warhead to the target. And in just about every single government position, there's a lot of training on fraud, waste, and abuse and identifying that stuff. And so I was taught to look at things through a certain kind of lens when it came to just our nation, because that's the numbers that I was dealing with in the Air Force. And understanding our taxpayer dollars and where they best spent, and looking at things like prevention and how there is a return on the investment that we have with the prevention work. And it depends on the program and what's happening, but we can be getting back anywhere between $3 and $25 per dollar spent on prevention work. And again, so 35,000 kids under the age of 5, just those that are under the age of 5. And if we can prevent the majority of those ER visits, that's a huge return on both time and money, both for the parents and within our healthcare system. And if you look at our healthcare system, it's pretty strapped. There's not a lot of slack in the systems. And if we're having to shift resources to address things that are completely preventable, we're not having as good of health outcomes for just across the board. Injury and violence is like a $4.5 trillion burden on our nation. And this is stuff that can be largely prevented. Yeah, sure, there's random acts of violence out there and stuff, but by and large, that $4.5 trillion that we're just saddled with, like, we can get ahead of that. I'm fully confident that we will be able to get ahead of it when we have these systems in place and when we have more funding for these programs. If you look at the CDC's Injury Center is one of the top organizations at the federal level for addressing this sort of thing. They usually get like $750 million a year. And then what they do is it's a pass-through organization. They don't keep it all for themselves to do stuff. It goes to the states. And then at the state level, everybody works together to say, okay, let's look at the data, like overdose data to action. There might be listeners out there that say like 750 million is a lot of money. But again, if you're looking at a $4.5 trillion issue, we're not spending nearly enough to combat it. Again, on that education piece, there's not enough. When I talk to new folks, people should just be like, oh, yeah, I completely understand medication lockboxes, already heard about it and everything, because that work has been going on for well over a decade. But I continually encounter people and they're like, what do you do? And I'm like, I sell lockboxes. What? Oh my gosh, that is so innovative and whatever. No, it's not. It's not like new and innovative. I'm just putting customer service on it, essentially. But yeah, going into the numbers and everything, it just doesn't make sense. If you keep a tree from falling in the woods, does anybody care? The data is there. And that's what is more important, is being able to see like, okay, that we've been doing these efforts and we're able to see certain reductions. And that, I guess that's also part of the issue, is understanding exactly which prevention methods were the most effective. We can't totally know, was it because somebody went and did a tabling event? Or was it because somebody got on the news? Or was it through, I mean, there's so many avenues to get the messages across and connect with communities. Like, I would love to be able to identify the secret sauce in there and really replicate exactly what that is and elevate that and get that really pushed out everywhere. I don't think there's one single specific thing. It's that culmination. It is the overall messaging and effort that is being put out there. And so when an outreach or prevention specialist encounters a new or soon to be parent for the first time, that's where the magic is. That's where it's happening, because then there's at least that awareness. We all live in our bubbles, and being able to pierce that even momentarily with a little bit of knowledge, that can keep people coming back for more. What a new parent is dealing with isn't the same as what a parent with a little bit of experience, a few more years, let's say the kids in elementary school. Well, different resources, different things, different topics. Middle school looks different, high school looks different. Like, it keeps changing. And so having that touch point, that point of contact where, any of these parents can call up their public health department or the children's hospital or any of that kind of stuff, saying, hey, like, what's going on with my kid? What's happening here? I did recently start putting my own inserts into the lock boxes. I'm plugging 3 organizations. The first is Operation Parent. I looked at their webinars, the guidance that they're putting out, the stuff that they're talking about, and it all looks great. None of it looks like it's stigma inducing. I believe that that is a piece that kind of posed us for a long time, is those initial efforts back in the 90s with Dare, Just Say No, and like, this is your brain on drugs sort of thing. I think it caused a lot of stigma, and in doing so, like, mistrust. You were saying like getting that trust component is critical when you're dealing with and looking at public health and getting folks to say conform to the messaging, listen to the guidance. It, of course, has come a long way since then. And so getting folks to understand like, oh yeah, no, this isn't stigma inducing kind of stuff. This is just basic kind of sciencey stuff. We've got the data. We know that if we can put a barrier between something that can cause harm and those who just either don't know any better or are intentionally seeking to cause themselves harm, like, you're going to reduce those incidences. In a way, it's really basic, but in another way, it's like trying to get everybody to get vaccinated or something like that. It is one of those things that until it's right, I'm not always going to sleep good at night. So the other organizations that I'm plugging over here, so I've got Operation Parent, who puts out free webinars, and the content looks great. I'm not a parent, so, you know, young people in recovery. So that's another thing, is that we don't think about, like, when I'm saying, like, hey, we've got these logbooks for medication assisted treatment. It's not just adults that are going through treatment. It's not just adults that are in recovery, and those kids need so much support, and the organizations that support those kids need support. So definitely that. And then, of course, the last piece is our poison centers. I've got a little blurb in my insert about, if you think somebody took something, call your poison center, because it's not all just children and accidental ingestions. And there's a lot of stuff out there that kids, pets, what have you, are getting into. So I plug those, and I hope that when the communities that receive the boxes, they're able to have that insert as a supplement to what each community might be doing. Because again, they come up with a lot of their own materials and stuff. And I figured just this one little double-sided insert could be something just to raise some more awareness to these resources that are out there.
There's that collaboration. So something that I feel like every once in a while I see something written where I say, oh, I have known that truth, but I have not seen it so precisely and well said. And on your website, you say affordable and available does not always translate to accessible, which, again, I read that and said, oh my gosh, look at the way that's summed up. Can you just speak to why it is that accessibility has to be a focus of prevention work? I just want to hear your thoughts on that.
So I didn't grow up with a lot. My family was poor. And so explicitly that, like, I get it. Just because something is affordable out there or available to be purchased doesn't mean it's accessible for everybody. Even at this price point, if you can't eat it or put it in your gas tank, it is not going to be purchased. And that's where more and more of our families are. And our poverty rates are going up, and the support networks are, they're not being funded. There's bigger and bigger gaps. Just knowing from personal experience, like, if somebody didn't, and that's another thing, is like getting in front of more people. Because, like, in my situation growing up, if somebody didn't show up at the door with a lockbox to hand it to somebody in the home, message is not going to be delivered. My parents didn't really go anywhere, do anything. They didn't have a social circle. They didn't go to events and stuff like that. That's why it's important to increase accessibility. And it doesn't always look like what we think looks like, you know.
Yeah. Well, thank you for giving a simple way to sum up something quite complex, but I just feel like that statement translates to so much of work that's being done in the community in a lot of different spheres. So, all right, it's time for me to ask you our question that we ask all of our guests, which is, what does the process of awareness to action mean to you?
To me, I mean, it means parents are able to be better parents. They're empowered, they can take action. And that's where everything happens. You can think about something all day, but until you actually do it, that's where the change happens. You can't just sit around and think about stuff. It's got to be put into practice, into the real world. And I do firmly believe that by continuing to educate and empower parents and foster providers, just everybody that has interactions with children, we'll be able to raise a generation that has this baked in eventually. I think that maybe one of the reasons why America is struggling with this kind of thing the way they are is because we are a younger nation. If you look at Europe and the way they do things over there. They've been dealing with their stuff as nations for a much longer period of time. And so it is just a matter of time and continuing to apply pressure, stay focused, and empower others. We'll get ahead of it.
I really appreciate that reflection, and I agree with your hopefulness. And I just really appreciate you being here and having this conversation with me. I think I really love getting to hear people's stories of seeing a need and how they chose to address it. But I think a lot of the stories I've heard are not someone saying, I'm going to be a good business owner. Like, I'm going to provide a tool and an intervention and do it in a way that is collaborative and can adjust for what these prevention specialists and community outreach workers really need. And I just really admire that path. So thank you for sharing about it with us.
You're welcome. I truly feel like I'm serving the needs of the nation again, like when I was in the military.
Yeah.
And telling you, it feels so good.
Yeah. Well, thank you again. I'm grateful you're doing the work and grateful that you were here.
You're welcome. Thank you for having me on. I had fun.
Thank you for listening. And thank you again to Mathew for joining us. Be sure to subscribe to Awareness to Action so you don't miss any of the inspiring conversations we have planned for Season 5.